The most important skill as an osteopathic family doctor is the ability to talk to anyone about anything. And beyond that, it's just learning stuff. Learn anatomy, learn physiology. That will come with time. But if you can't talk to a person, you're going to fail as an osteopathic family doctor. You need to understand how people tick. That's something that I learned early on. My first job in high school was in retail, and I loved that I could talk to people about whatever they wanted. My name is Ian Fawks, DO, and I'm a hospitalist at Cox Health in Springfield, Missouri. Osteopathic family doctors are truly, in my opinion, the best, because we're going to take care of you from head to toe. I'm also a colonel in the Army National Guard. Currently, I serve as the state surgeon for the state of Missouri, meaning that I'm responsible for the health and readiness of over 10,000 soldiers. We also have about 50 medical professionals that I'm in charge of. That's my state role. In my national role, I'm in charge of the credentialing of over 2,400 physicians throughout the 50 states and 4 territories. I've had a very diverse career. I'm a combat veteran. I've done osteopathic medicine overseas, manipulative medicine specifically. That's what I did to get my fellow award with the ACOFP. I've been an ER doctor, a nursing home medical director, and a prison medical director. So I get at the hospital about 6:15 and then see my patients. I then will be on duty for them until about 7 p.m. So it's very active for what I do. If I'm admitting, then there's shift work involved. So we have a large hospital here, about 500 beds. So I have patients on different floors. So when I round on a patient, I will actually go find the nurse first, ask them how the patient's doing, and then look through their data on the computer, and then go visit the patient, examine them, and help them understand what's going on before I generate a treatment plan for them. I come to work and I enjoy being here at Cox Health, and it's because I have friends with the nursing staff and with the other ancillary staff. We have a team approach to how we provide care here, and that's very fulfilling. That is also mimicked when I see my patients and know they're better because of me, because of my skills and my knowledge. When I can sit at the bedside and hold their hand and help them through their problem, that keeps me going. And so every day, if I know I can be that vehicle for a vessel for something good to happen, that's what inspires me. So we know osteopathic family medicine really focuses on the idea that the body is a self-healing, self-regulating mechanism, but it all depends on data. And so in my early practice, I would have patients call me, "Hey, Fred, check your blood pressure and tell me what it is," and they would call me. Well, if I have a blood pressure, a continuous monitor on them, or a smartphone or a smart device that can feed into them, and have that monitored, I could perhaps intervene sooner. There's many times here at the hospital as a hospitalist where I think, wow, if they just had a good family doctor to help them through this problem, they might not be here with heart failure. And so I think that's where the future of technology to intervene early to allow us to be more proactive. I had a patient that was actually at the point of having hip replacement surgery and was at their wit's end and was referred to me by an MD. And this patient had a horrible life situation. They couldn't hardly walk. They ended up having a sacral shear along with a sacral torsion. I did one osteopathic manipulative treatment and they were better, and their surgery was canceled. That was very fulfilling to be able to do that. And the MD, we're still close friends, and he was quite thrilled as well. There's many others where I diagnosed a problem that someone else had missed, or I was able to see through the issue that maybe someone said, person's just an alcoholic, but I knew they had other things going on. Those things happen a lot, and it really inspires me to be able to do that as an osteopathic family doctor.